And the timing that he was born at 11:30 p.m. on his due date.
Oh,
So guess what? Not only did he make it to 40 weeks, but he did not go over.
yeah, that's amazing.
Yeah. So that was where it
Wow.
was like, sweet little Calvin. I was like, you understood the assignment.
Hello, and welcome to Healing Trauma Mamas. I'm your host, Madon Wingo. Thank you for joining us as we share in our stories and experiences of healing from childhood traumas and birth traumas. Listen as we discuss our struggles, our failures, our strengths, and our victories, and all those lessons we've learned along the way. Why, hello, Healing Trauma Mamas. Welcome back to the podcast. I'm excited for our guest today, not just to get to hear her amazing story, but also the fact that she's a returning guest on the podcast. So I'm really excited to invite Haley back onto the podcast to kind of give us a life update. A lot of things have changed since she came onto the podcast back. I believe it was episode 24. And yeah, now we're up to episode 54. So it's so awesome to get to have Haley here for the podcast and update us. So, Haley, do you want to introduce yourself for a moment and maybe kind of give a little, just a quick rundown of what we went over before on the podcast, and then we'll kind of get caught up.
Yeah, so I'm Haley Laurence, and I am a mom of two now. When I'm not doing mom stuff, I work full time doing digital marketing for funeral homes. So I'm always doing like Google Ads, websites, Facebook, things like that for funeral homes by day. And then, of course, I'm a mom full time because I mean, as a working mom, that's kind of the best way to describe it.
Mm-hmm.
But yeah, and I actually have kind of a new venture that was inspired by you, and that is I actually started my own podcast. So for your listeners, if you guys are interested in talking more about the breastfeeding side of things, that's really what my podcast is. So it's the Breastfeeding Diaries. And very similar to what you've done, Madon, I actually just interview moms who've had overcome challenges to breastfeed their babies. And that was really inspired by what happened with my first baby. And so, yeah, that's kind of where I'm at right now is just doing work and then on the side, doing a little podcasting, which is fun.
Well, I'm really excited to get to talk about that because I've got some questions and I've got some things I definitely want to go over with you because I think it's awesome. I'm super excited. I was just listening in the car yesterday. Very excited, and I will talk a little bit later about that specific guest that you had on because I have really great ties to that guest as well. So it really warmed my heart.
Oh, sweet.
Yeah. So maybe let's start with last time you were on the podcast, we really talked about your first birth.
Yes.
And we talked about, just how things didn't go like you thought they were going to. Like you were having this beautiful pregnancy and you were doing all the things and everything just looked like it was so beautiful and wonderful. And you were just headed straight for this beautiful birth center birth that you were planning. And then that all kind of went out the window when your water broke. I think it was how many weeks were you?
It was 31 weeks.
31.
Yeah.
Yeah. Yeah. That
Yeah.
was
So
kind of
that's,
wild.
yeah. Everything was supposed to be great. It was supposed to be a birth center and get to have my water birth and everything. And then um, my water broke at 31 weeks, had to go to the hospital. I was in the hospital for 1 week before I started bleeding. And then I was taken back for an sort of emergency C-section. I mean, it was about 30 or 40 minutes later after I started bleeding. So it wasn't necessarily like, and the baby was fine the whole time too. So it wasn't one of those situations where anything was going on with his heart. But after the C-section, they did think that the placenta had probably started to abrupt, and that was what was causing the bleeding. And yeah, so I had him. He was in the NICU for 26 days. He came out, and like I kind of hinted at earlier, we were able to have a successful breastfeeding experience. And so after he was, yeah, after everything with him, when he was about a year old, I got that feeling of like, oh, I want another one. And up until he was 12 months, it was like, no, I do not want another one. I would see people post on social media like see someone else like posting that they were having babies really close together. And I was like, nope, nope, not for me. And we were just very, very strict about that before 12 months because I wanted to protect breastfeeding. That was my ultimate goal. And so I was like, I'm not getting pregnant. I don't want to jeopardize that. But as soon as he turned 12 months, that whole mentality switched. It was like this light bulb went off of like, yes, I want another baby. And so I went ahead and started to wean him around 15 months. And that's
Did
like
you?
a whole awesome story of just being able to breastfeed him.
Oh, well, I want to hear all about that, but I also want to hear did you have some challenges when you were thinking about that with I know we talked a lot about last time about like you finding so much joy in the places where
Mm-hmm.
the Lord had put you and what was you were going through with the NICU nurses and the other families that were there, and
Yes.
then in your postpartum journey, like really just finding the joy and all of those things. But also you had been through a lot.
Yes.
So yeah, so when it came time to thinking about having another baby, like what was going through your mind? Like what are some of the things that you were thinking about?
I think that there's like something that happens as you get further postpartum from like a crazy birth experience is that your brain just forgets. And so even
Mm,
when I was telling you the story, I think you interviewed me at like 11 months postpartum and I was like barely remembering all of the
mm.
bad things.
It's
And,
amazing how that
still
happens.
yeah, yeah, still telling people the story and, telling people how crazy it was, but just forgetting it all. And then there would be other moms who would have a NICU experience or have a surprise C-section. And I would just be like, oh, it's not really that bad, even though it was. But it was like my brain just forgot all of the bad parts. And so really, as I was thinking about having another baby, I was just thinking that I would probably try to have a VBAC and one of your other guests, KK, I can't remember what episode she was on, but she also is one of my good friends, and she had a really great home birth after a C-section. And
Good to
so
hear.
her story that happened. She had her home birth around the same time that my first was due. So she was kind of like one baby ahead of me. And so, and now she's had her third. So she's continued to stay like one baby ahead of me. And so seeing her experience was really inspiring. So I was like, I know I could do it. And so just like wanted to get pregnant so bad, but also knowing that me and my husband both kind of felt this that like we could absolutely go through it again. And having Owen, our baby, with us and just playing with him and everything, it was like, this is worth it. This is totally worth it. And so we just felt like even if we had another premature birth or something crazy happened, that we absolutely would go through it again, that it was totally worth it. Because when you have that baby in front of you, you're just like, okay, this is worth it. Like, and again, like I said, my brain blocked out all of the trauma.
Yeah,
So it
it
was
does
like,
that.
yeah,
Well, and it's just like right after, so even, after vaginal delivery, it's like you're in the moment and it's really, really hard. And you're like, I can't do this, and it's so hard and really, really rough. And then as soon as you hold the baby, it's like you get this flood of hormones and you're like, wait, what was I talking about? That wasn't bad.
yeah,
I've
yeah,
heard
it's
moms
like,
say immediately after, oh, that wasn't so bad. And you're like, you were
yes,
literally just saying like, absolutely not. I'm never doing
yeah,
this again.
yeah,
And it's amazing what the brain does. And so
yes,
for you, I'm sure, plus all that breastfeeding journey, you've got all that oxytocin flowing, and you've got all these things going between you and the baby back and forth, that beautiful bonding time that you guys are building. Like that's like kind of like taking away. Like the more and more you're building that, the more the other is
yes.
getting pushed to the background.
Exactly, exactly. Yeah, so that's definitely what I felt leading up to trying to get pregnant again. And one thing that I did was I mentioned my friend KK. She had helped me because kind of as I was starting to wean him, I started having just like some random like stomach issues. And it was nothing crazy, but something that she kind of figured out was that it was a little bit of just like some low blood sugar dips.
Mm,
And she had also suggested that I look into my thyroid. And so those are very common postpartum
yes.
issues. And so I went ahead and got in with a thyroid specialist in Abilene. And When I went to see him, all the numbers were great according to, medical numbers. They were like, everything's great. But because of that, I had decided to go gluten free. So about a month before I weaned him, and then later I found out that I had conceived our second, but it was about a month before was that I went gluten free. And when I went to talk to this thyroid doctor, he was like, well, uncontrolled celiac disease can cause premature birth. And so, kind of these little like radar went up in my
Ooh.
head because I was like, I did not have any symptoms of celiac disease at all, nothing related to that. And even when I cut out gluten, I honestly didn't really feel better. So, I don't really know that it was gluten. There was really no evidence that it was gluten. But because he said that, I kind of had this like radar went off, and he was like, did you have any issues with conception with your first? And I was like, no, but I actually did do a gluten free, sugar free diet a couple of months before conception with my first.
Mm.
And so I thought, okay, maybe let's just try this. And more so for the thyroid stuff. So I went gluten free. As soon as I was done breastfeeding, that was like my last period before I got pregnant. So it was like my body was like, we need to just do one baby at a time, which I appreciate. I was like, thank you.
Yeah.
So as soon as I weaned him, I got pregnant again. And as soon as I found out I was pregnant, I was like, well, I'm not going to eat a single bite of gluten because if that's what caused it,
Sure.
again, not knowing, not really having any issues with celiac disease. And again, that's uncontrolled celiac disease, which obviously comes with all of these other things, weight loss and issues with nutrition,
Sure.
which I was not having. So, looking back on it, I really don't think it was that. But knowing that I had a premature birth that was unexplained, as soon as I got pregnant, it was like, how do we stop that from happening again? That
Hmm.
was all I could think about. And so, back to your question of like, were there any fears or doubts going into my second? It really wasn't until I had that pregnancy test that was when all the doubts kind of came in. Because at first it was just like, oh, let's try to get pregnant. But then once I had that test, it was like, oh no, now I got to figure out how to stop this from happening again.
Mm.
And with my first pregnancy, I was fearless. I had no fears of miscarriage, no fears of anything happening. I just saw myself going all the way to 40 weeks and a home birth. Like I just never had any doubts of what my body could do. But now that I'd gone through that, then it was like everywhere I was seeing miscarriages,
Mm.
everywhere I was seeing fertility struggles. Like everybody's Facebook post was a fertility issue or miscarriage or a NICU situation. So it just seemed like it was all around me.
Yeah.
So I don't know. Do you feel like that's pretty common? I feel like that's kind of a common thing of like you don't realize how common it is.
I think you don't until you're kind of like again like the little radar goes off for you. I was just talking with a local woman who works at our pregnancy resource center and I was volunteering over there. And we started having a conversation with one of the women that had come in, and she was talking about loss, and she was pregnant, and she was excited because, she had had a loss previously. And when she was sharing, because it was a missed miscarriage, I have had way more clients go through that in the past year than I of course would ever want to see, but I definitely like I feel like it's uptick right now. I for some reason I just feel like that it has definitely increased.
Yeah.
But honestly, we talked about like how often we don't talk about it. Like once some things happen to you or you're alerted to something, it seems like all these women start talking about, oh yeah, that happened to
Mm-hmm.
me, or oh yeah, that, and
Yes.
you're like, wait, why was this not talked about before? Like, why was this something that
Yeah.
I didn't know about? Because the us three women in the room, we immediately were like, oh yeah, I've had a loss too, and I've had a loss too, and like we all started talking about it. They're like, oh my goodness.
Yeah.
And I think this is part of our conversation. What we kind of talked about was just like, if we are, I'm for all the babies. Like I'm
Yes.
absolutely, everybody knows me. I'm for all the babies.
Yes.
But if that is who we are, and I'm all for life, like all across the board, right? Then we should be talking about those babies as well. Like
Yes.
they should be
Yeah.
like we have. our little one Shalom, that we lost at 12 weeks. She has
Mhm.
an arrow, and it's up on our wall.
Yeah.
And the kids know, like that's Shalom, and I have a tattoo on my ankle that is her
Yeah.
name and her birthday.
Hmm.
So we try to incorporate her in the conversation sometimes,
Hmm.
about the children's siblings, even though Stephen, who was not conceived when she passed, he knows about her because she's been a conversation because she's a part of our family. And I think whenever we start incorporating that into our actual conversation, then these things are going to come out, but they're hidden a lot of
Yes.
times because why? Because we don't feel safe to talk about it. We don't feel like we're told, well, you can get pregnant again, or we're told, oh, well, you were only 8 weeks or only
Hmm.
6 weeks, you just found out, or whatever the case might be. Like we're told all these little like quips that really don't make sense.
Yeah.
And then so then there's maybe some shame, maybe some, guilt, maybe, these different things that come into play. And so it's a quiet thing that we just kind of push aside and only very close people to us know about it. But I
Yeah.
am all for like, we need to talk about these things. Like when people
Yeah.
ask how many children I have seven. One doesn't get to be with me, but I have seven.
Yeah.
And that conversation,
Yeah.
that we need to
And I
have.
think it's also it's having the conversation, but also not like making that a reason to live in fear.
Oh, for
And I
sure.
think that's where I was at was like I'm seeing so many people go through this that I was like, oh my gosh, what if it happens to me? What if I'm next? I've already been through something. I don't know what my body can do. And so I had the pregnancy test on like a Friday. And that Sunday, my older son was hospitalized with RSV.
Oh, that's
So
rough.
yeah, so he had already been he basically has been diagnosed with asthma at this point, which is crazy going back to his birth story because his lungs were fine. When he was in the
Mhm.
NICU, he had no oxygen, no lung support. But after having RSV a couple of times, he's really struggled to kind of kick that. And so anyway, so gets hospitalized with RSV. And so I'm back in the hospital and it's like the last time I was here was when I had this C-section.
Oh my.
So we're in the hospital, we're in the children's unit, and the smell in the bathroom was really kind of triggering that because I was also cramping a lot, which I did not cramp with my first pregnancy.
Mhm.
But here I am, it's like I'm 7 weeks and I'm having a lot of cramping. And so, and the very last time I was in this bathroom with that smell, was like I'd seen blood.
Oh.
So every time I went to the bathroom while we were stuck in the hospital, every time I went to the bathroom, I looked for blood, just thinking like
Mm.
there was going to be blood. So that was probably like one of the lower moments of like thinking that it was so early. It was 7 weeks. That's so common. And then I'm smelling that smell. So, and of course, I hadn't had any, I'd just taken the test. So I hadn't had any ultrasounds or anything yet. And
Sure.
so I had no knowledge of like what was going to happen. So, really just having to trust God and trust that, like, even if it was a miscarriage, that I would be okay. Um, and so, yeah, I was having a lot of cramping, a lot of pelvic pain. Um, and then he got out of the hospital. Oh, and the whole time he was in there, this was interesting too, because like when we were thinking back to when we were in the NICU, and when we were in the NICU, he was our first, we didn't feel like we were parents because like the nurses would change his diapers and we hadn't got to take him home. And so we just felt like the nurses were kind of like his parents and we were
Mm.
just there observing. But this time it's like we're the ones changing his diapers. We're the ones holding him down while he gets poked and prodded. We're the ones who know exactly what food he likes and what drinks he likes and everything. And so it was like a very different experience of being like, we're the parents. We know how to, this is our kid. And we're there with him by his side every minute that he's in the hospital. So that was really cool. And I guess maybe a little bit healing for us because we
Mm.
just felt so confident and just felt like we can do this. We're parents. We have what it takes and not feeling that like helpless feeling that we had before.
Oh, that's
So,
so good.
and RSV is really like, I know people, this is like a side note, people say it's really scary. It really was not as scary because he was really just being given fluids
Oh, okay.
and then basically just the nebulizer, which we have at home. Like nothing crazy. He wasn't on oxygen. So it was actually pretty chill for a hospital stay. So I just don't want to freak people out about RSV because um also everybody gets it. So anyway, that was kind of a funny thing because I got RSV. We all got it from him.
Oh, the whole
And
family?
so, yeah, and so we were all coughing, and that cough, okay, that part was miserable. We coughed for like 8 weeks, all of us.
Ugh.
So that was the beginning of my pregnancy. And also, I was more nauseous this time. So my whole beginning of the pregnancy is like coughing, nauseous, and like it was a very gagging cough. So it was just like, I like joked that I like couldn't kiss my husband. It was like, ew, ew, ew. Like, I don't want to kiss your mouth. Like, it was just like,
Yeah.
and so it's like, I promise I'm attracted to you. I just,
Can't do it right now.
the nausea.
I get you.
Um, and the nausea wasn't bad either. I really just ate a lot of protein and kind of realized that it was very much a blood sugar thing for me. So as long as I had the protein, kind of kept eating little snacks and little proteins and things throughout the day, I ended up being fine. Um, and so when I got my first ultrasound and doctor's appointment, I went to the same doctor that had done my C-section because I had heard that he was supportive of VBACs. So went to him, and at the first appointment, I was like, so what do you think caused it? What do you think caused the premature birth? And I was like, and
Mm-hmm.
what do you think we should do? And he was like, well, there's just not really any evidence. There's not really anything we can do. And he was like, the most likely cause was an infection. And we don't know if you had an infection. So we don't know. And he was like, we could do progesterone, which progesterone is typically used when people do have recurrent miscarriages early on.
Right.
And he was like, that's usually used early on, and there's no evidence. Keep this in mind because this is going to come back. He said there's no evidence to support doing progesterone.
Okay.
And then I pulled up the labs that my friend KK had ordered or wanted me to order from him. I pulled them up, and on there was progesterone. And he was like, nah, we don't need to draw that. We don't need to draw your progesterone. And I was like, well, why do you want to give me this hormone, but you don't want to draw my blood for it? So I was kind of annoyed with that. And I was like, no, I'm not accepting a hormonal treatment
Sure.
unless we get evidence for it. And he was like, yeah, there's not really any evidence. I was like, okay, I decline that. So there was a lot of declining that happened. And so anyway, we left that appointment. And since he didn't want to do any of those labs, I had to pay for them myself. So I paid like $300 to get the labs that she wanted me to get. And we got those back in like January. So at this point, I was heading into my second trimester. And the only thing I was really doing at that point was gluten free. Other than that, there was not really anything else that I felt like I could control. Just trying to just accept how the pregnancy was going. Well, then we get the labs back, and my progesterone is so low. It is low. It is like down as
Oh
low as
my
it can be.
goodness.
And my friend, who she's also a functional nutritionist, so she pulls up this study by the Pope Paul Hormone Institute, is what it's called. And it was a study that they had done on progesterone. And what they had found is that there was like a certain like limit you could see on this chart.
Right.
And anyone who was below that line for progesterone throughout each trimester, if they were below that line, they were more likely to have premature birth, placental abnormalities, or things like that. So there it was, a study, and my number was so far below the line. So
Wow.
that was a scary moment because it's like I'm looking at it going, my progesterone's so low. And it's like way below what this study is saying that
Right.
could be very risky. So my friend was like, you need to call your doctor and see if you can get some progesterone. So here I am after I declined the progesterone. Now I'm having to call the doctor and ask for the progesterone.
Changed my mind.
Yeah. So I call him and I'm like, but this is so funny. He was like, well, why do you need that? I'm like, you were the one who told me we could do it with no evidence.
Oh my
And now
goodness.
I'm sending you evidence. So I had like uploaded the labs to like the portal. And so he's on the phone with me and he's just like, so yeah, why do you need this? And I was like, look up this study. It was like, my progesterone's low. He's like, no, it's in range. Like, according to the medical stats, it was in range, which the range for the second trimester was like really small to a really big number.
Yeah.
And I was like, no, go look up this study. And I hear him like going, clicking on his computer. And I'm like, oh my gosh, here's a doctor. And he has to Google what. And so I don't know. I think it was cool though that he Googled it. Like, looking back
Yeah,
on it, I'm like, I don't like judge him for that at all. I think that's why you have to advocate for yourself, because you
absolutely.
think a doctor is like so educated. Guess what? They have to Google things just like we do.
Yeah, and there's new studies that come out all the time on everything. I mean,
Yes.
like, and especially when there's such a broad range, like even OBGYN, excuse me, OBGYN, there's so many different areas that they might need to be studied up on. And, I mean, they
Yeah.
try, but new
Yeah.
studies that come out and new meds or new, protocols and stuff, I'm sure it takes lots of time.
Yes. Yeah. So we get that back. Or when I talked to him on the phone, he was like, oh, okay. He was like, he pulls up the study and he's like, all right, I'll put in the prescription. So he puts it in. And oh, one other thing that had happened in January, so I'm just heading into my second trimester, is that I won my company's trip to the Bahamas.
Woohoo!
So here I am, like, not knowing what's going to happen with my pregnancy, and it's going to be when I'm 27 weeks. So, and here's this opportunity to go to the Bahamas for free. My company is going to
Wow.
pay for me and my husband to like fly, stay in a fancy resort for a whole week. Huge honor that my company does. So, I had already called my doctor and asked him about that. I was like, hey, do you have any reason why I shouldn't go? And he was like, no, go. He was like, tell me when we're packing our bags, I'll come too. He was like, I want to go to the Bahamas. So anyway, so that happens. And then later I get the progesterone. So we start doing that, and it was just a vaginal progesterone, like 200 milligrams or something. So I start doing that. And then really nothing else until 24 weeks. I had some really intense cramping that felt more than like abdominal or like digestive. And I went to the bathroom and I saw one tiny drop of blood, like
Mm.
less than a fingernail size. And I was like, oh, I'm going to the hospital. And I felt a lot of kind of pressure along with the cramping. I was like, oh, this is it. We were at 24 weeks. I was like, this is it. This is happening. Um, I'm having another premature birth. So I called the doctor and like, go to labor and delivery. So me and my husband go to labor and delivery. And we're thinking, okay, this is what we feared and this is what's gonna happen. And they check everything and they're like, girl, you are not even a bit dilated. This is not
Yay.
contractions. And they were like, honest, there was no more blood. Like, they did a cervical check, not a drop of blood. And they were like, maybe it was just caused by like movement or like sex or something like that. They were like, let's just go with that. So that's what they went with. And they sent me on home. And
How
that
did
was
you
really,
feel about that? Did you feel like
I felt
comfortable
relieved.
going home? Okay.
Yeah, I felt fine going home. And at this point, like, I wasn't really having any more cramping or anything. And I was like, yeah, maybe it was just a little change, little hormonal change there at 24 weeks. Um, and prayers, and it just was okay. And so after that, so 27 weeks rolled around, we go to the Bahamas. It's an amazing trip. Everything's
Oh,
good. I got my
yay.
compression socks, I got my electrolytes, like, and I'm also along with the nutrition stuff, I'm doing like a little bit of beef liver here and
Good.
there. I'm eating every healthy fat I can find, 100 grams of protein a day, 100 ounces of water a day, just going hard. And then in my exercise, I'm just going as hard as I can, obviously for the VBAC. But at the back of my mind is like, even if I have another C-section, these exercises are helping me feel good and they're going to help me recover faster. So just keeping in mind that like all of those exercises weren't going to be for nothing,
Sure.
and everything, like my posture, like I'm not
Mm.
slouching while I'm watching TV. I'm going hard with these exercises every day, like starting at like 24, 25 weeks, I'm sitting on a ball at work, I'm walking every day. I'm weightlifting. I'm just doing all the things.
Mm-hmm.
And so I go to the Bahamas, and this part you can edit out if you want or not. It's up to you. So I think my doctor would be okay with this. So when I go to the Bahamas, I find out that he was arrested. My OBGYN was arrested. And so um,
Okay.
I find that out while I'm in the Bahamas. And I'm like, what? Like plot twist. And here's the supposedly the only doctor in Abilene that supports a VBAC.
Hmm.
And he's been arrested. So we get back to town. We find that out. We had some friends who were on the board of the hospital that kind of gave us some of the backstory. Everyone we talked to was like, he's a great guy. Like, listen to his side of the story. And it was a domestic situation with his wife where he had actually called the cops himself because of the fight. And yet the cops arrested him. So that was his side of the story. And after 2 week break, he was reinstated by the hospital. So then I had an appointment with him, and he was like, do you have any questions about like what's going on with me? Because everybody knew.
Right.
And I
Yeah,
was
I
like,
remember hearing all about it too.
yeah, I was like, hey, I was like, I don't really have any questions. I was like, he kind of gave me his side of the story. And I was just like, if it doesn't interfere or affect your medical practice, then I don't really care. And also, throughout all of this, I'm still totally believing that birth is natural, physiological, and I don't need a doctor.
Right.
I told him several times, I was like, I'm using you for the insurance so that you can get me these prescriptions that I need, and so that I can, get everything written correctly on my insurance. And he would laugh about that. He was like, you're just using me for the insurance. I'm like, yeah, because birth is natural, it's physiologically. I'm the one doing the work. God is doing the work to have my body do this. So I really didn't care, honestly, that this had happened to him, because I was just kind of like, I don't really need you to be there necessarily. Like, I'll have this baby in my car or in my home if I need to. Which I know is not the mindset of a lot of people. Like, a lot of people put a ton of faith in their provider, which is great. Like, that you do need them to make those big calls. And that's what I needed him for. Like, I wanted him to make the big calls and to um put things in with insurance. But other than that, I was like, I don't really need you that much.
Yeah.
So the other thing that happened, I think, so around 30 weeks, so right around the time that my water broke the first time, I was also set to go on another trip. This was a work trip. It was going to be a 2 day trip to Minnesota, and I was actually going to get to ride on our company jet. And right before that, I had smelled a little bit of a fishy smell.
Mm-hmm.
And I
Okay.
thought, okay, could this be a bacterial infection?
Mm-hmm.
And that is one of the causes of water breaking early, is like an uncontrolled bacterial infection. So at about 29 weeks, I had gone in and gotten a swab for that, and they found a little bit of bacteria. And I was like, give me the antibiotics, just give it to me. And my nutritionist friend, she was kind of like, hey, like, there's not a lot of evidence for antibiotics versus probiotics. Like, you could probably do some probiotics that could kick that without the damage to your gut. And I was like, I'm not taking that risk. This is
Yeah.
so serious to me. Give me the antibiotics, give me the probiotics. So she said, let's get you some probiotics that are actually inserted vaginally,
Yeah.
which would also help with preventing GBS. So I went ahead and started that. And I just did a lot of gut healing protocol at the same time, knowing that those antibiotics were going to cause some damage, but feeling like this is the opportunity. I'm right at 29 weeks. I'm right at the time that something is in my control, but also knowing like it's all up to God.
Yeah.
So I go on the private jet, go to Minnesota, everything works out great. But the whole time, there's just a lot of fear and a lot of thinking, like, what if I get stuck in Minnesota and like have to go to the NICU here? Like, just a lot of those fears.
Sure.
Um, but we made it back, and my husband was like, you're not going anywhere until this baby's arrived. I was like, okay, I won't. And so Yeah, 30 weeks goes by, 31 weeks goes by, 32 weeks, 33. And it's like, oh my gosh, we beat that. And after we beat
Yeah.
32, after everything I learned about, premature babies, I was like, every week counts now. Every week is going to get him further. Oh, I don't know if I said that this one was also a boy.
No,
So
but
I
that's
already,
awesome.
I already knew the gender that it was another boy. And so, and we named him Calvin. So every night we would pray, Dear Lord, let Calvin make it to 40 weeks.
Oh,
Dear Lord, let Calvin make it to 40 weeks. We get to 35 weeks, and 35 weeks is the milestone for not having to go to the NICU.
right.
Anything before 35 weeks, straight to the NICU. And I actually had a friend come over. We did a little like nesting party and we made breast milk soap with the really old breast milk I had from my first. And we packed my bag and we were like, okay, we made it to 35 weeks. Like, if I have this baby now, I would get to possibly take him home, which was just something I didn't get to do before.
Yeah, it's a big
So,
deal.
yeah. So it's like, and then it's crazy because like now we made it to 35 weeks, then we make it to 36. And we go to the doctor, and I'm like, should I stop the progesterone now? Because I've still been doing that. And he was like, yeah, you could start tapering it off. Like once you get to like the last of that container, you can stop. And um, so that was 36 weeks. Or I think at 36 weeks, he says, so yeah, let's talk about an induction, but not like really in it. I was like, and of course, building up to this, if it had been like a normal experience, I would have been all about like inductions off the table. Like, we got to put
Sure.
all these limits on it. I don't want to hear about that. But because I didn't think I would make it that far, I never once brought it up. I didn't talk to him about it. I didn't talk about his thoughts on it. I was just like um, trying to just make it. And something else that we had said that we shook hands on, I said, you stay out of jail and I stay pregnant. We shook hands. So that was our
Oh,
deal.
that's funny.
And he was like, okay, deal. So we get to 36 weeks and he's like, all right, well, I really need you to start doing some of these natural induction methods, like intercourse pumping, different workouts and stretches, just all of those little like natural things, which you and I know don't really
Right.
work. You cannot
Mm-hmm. If the
make a baby
body's not
come.
ready, then
Yeah.
not ready.
Yeah. And also knowing that he was a boy and boys typically do might take a little bit longer
Yep.
for
Very
gestational age.
true.
So, and of course, I like knowing what I know about seeing a baby born so premature, I'm like, every single week counts. Like, I've seen babies that are over 40 weeks that are actually can end up being like very advanced in milestones and things like
Mm-hmm.
that because they just had that extra baking time. So I was like, no, we're not talking about induction. We're not trying to do any of that.
You know,
But, oh, go
what's
ahead.
really interesting is actually I was just reading a study and listening to some things in regards to supplementation, progesterone supplementation, and how actually what they are what they are seeing is that, we say that somebody's overdue. We say that a baby's overdue, right? Past 40 weeks. And, that means, oh, it's time and they didn't come yet and they're supposed to. Actually, what they're finding out is that the gestational age that a baby goes to actually has so much to do with the mom's hormone production.
Oh,
And yeah, it's a really amazing
interesting.
study. And so it's really interesting to look, and I'm starting to keep stats in my practice as well, and I'm trying to look through a bunch more, is that those moms who have that higher hormone production and they generally, like their body is just like ramped up and they're producing really well, then those moms generally will go a little earlier. Or right at 40 weeks. And those moms who are slower and maybe less, and so their body is taking a little bit longer time with that progesterone, maybe building it up, and maybe if they end up having to be on supplementation or whatever the case might be, that they will go longer. And it's not that
Interesting.
one was overdue or one was that they just they grew babies at different rates.
Yeah.
And I was like, wow, I love this. Like this is absolutely amazing to get to hear. So I think that's really interesting that you're on the progesterone supplementation this time
Mm-hmm.
and then you're getting further and further. So how far along are you now?
So at this point, I was at 36 weeks.
Okay.
And I will say the other thing I did to support progesterone, a couple of things that nutrition wise that my friend had recommended. One was to cut out caffeine. So as soon as I got that number, the progesterone, I cut out caffeine and just anything to lower cortisol. She recommended a supplement. It's called Fullwell, and it was a like anxiety support thing.
Hmm.
So it was like just some calming herbs. I don't remember what it had in it, but they were pregnancy and postpartum safe herbs. That was just like a little tincture that you just drop in some water anytime you're feeling that like stress buildup. So it was really just working on my lowering my cortisol and raising my progesterone. And I did take some labs a couple more times and my progesterone kind of stayed pretty low. Like it stayed below that line. I don't think we ever got it up above the line, which was discouraging, but also we kind of theorized that that could have been like maybe it was getting higher day to day, but like on the day that my labs were drawn, it might have dipped. And also,
Hmm.
because some of the studies where they had done it, they got them every single day or every single week, and just some weeks they would dip below that line, but just trending above that line in
Hmm.
general. So that was kind of the goal there was just let's trend above that line, hopefully. So yeah, made to 36, make it to 37. And I start like pumping a little bit at night, like just kind of hooking up my pump and doing it for a few
Why do
minutes.
you
Just,
think that he was thinking he needed to start doing something by
oh, yes.
37? Yeah.
So he was thinking that he wanted me to go into labor naturally, and that if I went over 40, that he was going to have to push for like a forced induction, like
Hmm.
with a hormonal induction. And once you have, so there's kind of the cascade of interventions, right? So once you have the hormonal induction, you have the more intense contractions,
Right.
which puts you at risk for the uterine rupture, which also puts you at risk for, or then you're needing more support, you're needing an epidural. And so it's just a cycle of cascade. And what he wanted was for me to go into labor naturally before 40 weeks,
Okay.
because from his standpoint in the medical system, he was like, if you go over that 40-week mark, I'm going to have to push these things,
Hmm.
and I don't want to have to, because you want your VBAC. So he was trying to support my VBAC, but within the limitations of the medical system, which, as you know, has all of these rules and these restrictions, and not
Sure.
understanding the research.
Yeah.
So, and I knew that too. And so my thought was like, obviously praying. And of course, the whole time we're going, Lord, let Calvin make it to 40 weeks. But now
Right.
we're like, but also let us go into that labor naturally. And so um, at 37 weeks, he was like, so can I do a membrane sweep? Kind of get things rolling. And I was like, no, no, no. I was like, hold off on that
Good
membrane
job.
sweep. So then 37 and a half weeks, I'm at work and I had a meeting with my boss and I start shaking. And I thought, oh, maybe I'm having anxiety. Um, Maybe it's low blood sugar. I have a meeting with another coworker who said we needed to talk, and we had some coworker drama. And so
Sure.
when she calls me into a little office, I'm shaking like crazy, like full on shaking. And she was like, girl, I cannot have this conversation with you. You are shaking. She was like, I can't take you seriously. So she was like, you go figure out you. And I was like, I think I just need some sugar. So I go back to my desk. I have some dates and I'm just shaking uncontrollably. I was like, I'm going straight to our nurse. So we have a nurse in our company. So I walk back to her and I'm shaking and she starts assessing me. And then I was like, can you call my husband? Because I couldn't even text him. So she calls him. He also works in the same company. So she was able to call his direct line. Like, hey, well, I need you to come get Haley right now and take her to the ER. And she checked my heart rate, my blood pressure, and she sees me shaking. She's like, go straight to the ER. So we go to the ER, but it's at the South Side Hospital. My doctor is at the North Side Hospital. And so I check into the ER and I was like, I think I just need sugar, y'all. I just need some sugar. So they give me some orange juice and I stop shaking. So I was like, it's probably blood sugar. And they were like, well, we can't let you go. We got to run tests. So they start running different tests. And Nobody checks on the baby. And it's been like, as time goes by, like eventually we've been there for like 5 hours. Nobody's checked the baby. Nobody's taking us up to labor and delivery. Nobody's talking to us. They won't tell us what's going on. They're like, we need to do a COVID test. And I was like, nope, decline. And they were like, well, we need to take an x-ray of your heart. I was like, an x-ray? Why don't I want an x-ray? Like, I'm pregnant. I don't, how am I supposed to do an
No.
x-ray? And they were like, well, you declined the COVID test, so we have to do an x-ray. I'm like, what? I'm like, I don't have COVID. I was like, I just was shaking. Let me go home, please. And they were like, your heart rate is so high. And I was like, well, yeah, it's high because I don't want to be here. And so finally, after like 5 hours, like, can y'all please just get a Doppler and check this baby? So they checked the baby's heart rate. He's fine. And they were like, well, we need to check you into labor and delivery now. So they finally checked me into labor and delivery. And it's like 10 o'clock at night. And at this point, I've gotten my in laws to obviously pick up my older son, and they've got him taken fully care of. Well, they check us in, and we were like, can we leave? Like, there's nothing wrong with me. It's like, can
Yeah.
I just leave? And they were like, oh, we need to start your antibiotics. I'm like, why do I need antibiotics? And like, oh, well, you have a UTI. And I was like, okay, well, can I take the antibiotics and go home? And they were like, nope, we cannot let you leave. And we were like, what happens if we leave and walk out? They were like, you have to sign in against medical advice, and your insurance will not pay for this visit, which is actually not true, supposedly, but we
It,
didn't know. We had no
yeah,
idea. We were
it's
like,
not. That's a fear tactic that they use a
yeah.
lot.
And we were like, we cannot afford an ER visit. So, um, to pay out of pocket. So we were like, okay, fine, we'll stay. It'll just be one night, you know? And the on-call doctor was not even going to come in. He wasn't even going to check me out. He was just like, I can't let you go. So at about 3 a.m., I start shaking again. And they give me some Tylenol. They said I was running a fever. So after that, the next day, it's revealed they're like, well, we think this might be because of your UTI, but we didn't get a good enough sample to figure out which antibiotics to give you. So we need to go in and do a catheter. So they do the catheter. And the funny thing with that was that they had two different things, and they were like, I would rather use the big one. And I'm like, you're saying the big one? You're gonna put the big one in me? Like, why are you
Ugh.
calling it the big one? Like, can y'all work on your bedside manner here? And they were like, yeah, let's do the small one. So they start doing the small one, and it hurts so bad. They were like, let's do the big one instead. I'm like, what? That's gonna hurt. Well, it turns out the big one actually does not hurt because it's rubber. So all of that to say, yeah, nurses and their bedside manner. It's great.
Oh
Um,
man.
so they finally get the sample, and after that, there was a lot of blood, but it was not from the vaginal area, it was from my bladder.
Oh.
So that was not fun. And so found out that it was a UTI and that my blood was actually septic. And that was why this was happening. And I was like, oh, great. Well, because everybody I've known who'd been like septic had a C-section. So
Mhm.
I was like, great, this is it. Just thinking, like, well, at least we made it to 37 weeks. We know this is a full term baby. Thinking we're going to have a C-section. And the doctors at the Southside Hospital said they absolutely would not support a vaginal birth. They would only support C-section. They would not support a VBAC. And so I was like, oh man. I was like, well, hopefully if I did go into labor, I could just go into labor and before they notice or something. So anyway, they kept me there for 3 days, and it was so frustrating because they wouldn't tell us when we could leave, and
Oh my
it was just very
goodness.
frustrating. And my older son's birthday was that Saturday, and I finally got out of the hospital Friday night. So I got to
Oh,
be there for his birthday. And by the time I got out, I was like totally healthy. Everything was better. I had done like a lot of antibiotics at
right.
that
Yeah,
point. I'd
with
done
sepsis
so
for
many,
sure.
yes, so many antibiotics. And my doula was like, oh, yeah, that always happens to me. I always get a UTI. Take your D-mannose pill supplements, which are for UTIs. And I was like, man, because I was overthinking, I'm just not healthy. I must be so unhealthy. Like my gut must be so messed up. And then I said several of my friends who are very holistically healthy said that they get UTIs when they're pregnant.
Yeah.
And I was like, oh, okay, I'm not alone. This is common. This was not
Very
necessarily
common.
my fault. Of course, I wish I had known about maybe being a little bit prepared with the D-Manos and everything, but lessons were learned. But yeah, so at this point, I'm 38 weeks. I go in for my regular checkup with my doctor. So back at the north side, and I'm covered in bruises from how much I've been stuck and everything. And my doctor's like, all right, so want to do a membrane sweep? And I was like, no. It's like, I do not want to come back to this hospital. I don't want to have this baby yet. Just keep him in. And me and my husband were like, we do not want to go back. Like, we keep us away. And so
Yeah.
um, I was like, absolutely not. I was like, I don't want to be here. I don't want you to stick me with anything. No. So 38 weeks goes by, 39 weeks. I'm starting to get a little anxious and like I'm not even having a single cramp or contraction or anything. No Braxton Hicks, nothing. So 39 weeks, I was like, okay, do the membrane sweep. So he does the first membrane sweep. And so at that point, I think I was 1 centimeter. And after he did the membrane sweep, I was like 2.5. So we did that on a Monday. His due date was July 6th, which is a Saturday. So this was the Monday before. And then he was like, okay, you try and go into labor. He's like, after we do this membrane sweep, you go home, you take the castor oil shake, like you make this labor start. And I was like, no.
Wow.
I was like, I am not doing castor oil shake. That sounds terrible.
I am
Everything I've,
surprised he recommended it.
yeah, he was like, I want you to go home. I want you to do it. He was like, you're going to do it with peanut butter and banana, and that's going to make the digestive issues not as bad. But everybody who's done that I've heard, it was terrible. And I did not want to be in the bathroom. So I was like, no. So I prayed about that and I was like, okay, should I do it? Should I not? And I decided not to. And I just kind of kept doing my thing. Oh, I did forget to say that he was in a really good position, the baby. I had done a lot of exercises and I thought that maybe he was breech a little bit earlier on. And so I'd gone to the chiropractor. I had done the thing where you lay on the ironing board
Mm-hmm.
upside down.
Mm-hmm.
Um, and when they figured out where he was, they were like, oh, he's in a great position. So he was in the, I believe it's called right occiput. I don't know if you know those
Occiput.
better than me.
Was he ROA?
I believe that's the right one, the one
So it'd be right
that's like,
occiput anterior. That's a really
yes.
great
So
position.
he was in the perfect position. I had been reading my spinning babies, looking at all of that, making sure he was in the right spot and never leaning back on the couch, like always leaning forward, always making sure he stayed cozy right there. And then I'm doing the mile circuit as
Yeah.
well.
Okay.
So my lunges and all that. So we do one more membrane sweep that Wednesday. So the Wednesday before the 4th of July. So it's July 3rd. And I told my doctor, I was like, so if I go to labor on July 4th, are you going to be there? Because it's a holiday. And he was like, nah, I won't be there, but you can still go into labor. Like, just do it. He's like, just go into labor. He's like, I want you to go into labor before 40 weeks. And I was like, listen, doctor, we told God 40 weeks. We prayed every night. We said, Lord, let him make it to 40 weeks. And I was like, I can't change the plan now.
Yeah.
And so 4th of July goes by and it's actually super relaxing. I don't try to do anything to induce labor. I just enjoy time with my family. We go see fireworks. It's amazing. So all of that goes by 4th of July. Then we get to July 5th. And I'm going to stop for a drink of water. Okay, so we get to July 5th. And um, throughout that day, it was pretty chill, but I was trying to do a few more things. I still didn't take the castor oil shake. I decided to do the mile circuit again. And then I did a lot of walking. And it's like 100 degrees, of course, because it's July in Abilene. So it's like 100 degrees. I've got my compression socks and my cooling towel, and I'm got my belly band, and I'm just walking around the neighborhood. And then we went to dinner with Will's family. And while we're eating pizza, I have one contraction, my first contraction. And I was like, ooh, what was that? Because it kind of felt like a cramp, but not. And I was like, oh, that was cool. I was like, could this be it? I was like, we better go home and go to bed. So we have dinner with my husband's family. We go home, we go to bed. I wake up at 1 a.m. And from that point on, I had consistent contractions. They never stopped. It was amazing. So 1 a.m., I wake up, I have contractions, and they're happening every 4 minutes, and they're lasting about like 30 seconds. Actually, maybe they were 10 minutes at first, but they started to kind of speed up. So at about 6 a.m., I didn't sleep that whole from 1 a.m. to 6 a.m. Didn't sleep at all, but I
Mm.
rested and I was really excited. I didn't wake up my husband or anything. I was just like, this is early labor. Woohoo. So then I text my doula at like 6 a.m. and I'm like, or I called her. I was just like, hey, just so you know, like I've been having contractions. She was like, okay, make sure you're using the contraction timer and just holler at me if anything changes, but just go about your day, try to get some rest. I was like, I can't rest. So we get up, it's a Saturday, we do our Saturday thing. So we go to the farmer's market, we buy some honey, we go to Jason's Deli, we have lunch, and the contractions, like honestly, I feel like they're great because I had horrible cramps
Yeah.
as a kid. And this, remember, this is my first time having contractions because with my first birth, I had absolutely no contractions. It was just water broke C-section. So this is my first time experiencing contractions, but having had like horrible cramps as a teenager and, cramps that had me laying in bed, doubled over in pain, this did not feel bad at all because it was like the pain comes and then it goes and then I'm fine for 4 minutes. So I had Jason's Deli, and I remember my in-laws were like, oh no, you can't eat at Jason's Deli while you're in labor. What if your water breaks? And I was like,
And
this is fine. I was like, so this is early labor. It's chill. So we get home, we have put my toddler down for his nap, and then I was like, let me do the mile circuit again. And that was like my first little change and like shift. So that was the first time I saw like a little bit of blood. And then the contractions got more intense. So after I kind of got up from doing the mile circuit and I took a nap, tried to take a nap, listened to Christian hypnobirthing tracks, got up from that, and I was like, okay, these are serious enough that I can't play with my toddler anymore. So told my husband to hop him over to the in-laws and the dog too, and let me just kind of start focusing.
yeah, what was
So
your goal here to labor at home as long as possible before you went in?
yes. Oh, yes, yes, yes. So my goal
Yeah.
was labor at home as long as possible. Like I was literally like, I'm good if we have this baby in the car because I did not want to go to the hospital and
Right.
stall and head towards a C-section.
Right.
So that was my goal, was to get as close to like delivering the baby as possible.
Awesome. Yeah.
So after that, like getting into the evening, my doula comes over and we're just talking in between contractions. We're trying different things. So, like, as the contraction would come, she'd be like, okay, let's try a different position. Let's try this. Let's try that. See what feels good. But we're just having conversations about life in between and just having a good time. And so, yeah, so my favorite position was laying over the yoga ball on my hands and knees, but laying over the yoga
Hmm.
ball. So I just kind of kept going back to that one every time we would try to figure out what was felt the best. So I was doing that and like everything was cool. And then at about like 8 p.m., my doula was like, I need to go grab some dinner, get some things for myself, and then I'll be right back. So she's like, why don't you try and rest, try and take a nap? So I lay down on the couch and I can't sleep. But after laying down, they got way more intense. And at that point, I started panicking that she was taking so long. I was like, why is she taking so
Hmm.
long? What is she doing? Where did she go? Like what is going on? Like why is she taking so long? And so that was my cue to go to the hospital. And like looking back, that was probably transition
Mm-hmm.
because there was panicking and there was a little bit of nausea. And I called her and I was like, where are you? Like, why are you taking so long? And I don't think she'd been gone that long, like maybe like 30 minutes, but
Just felt like
she,
it.
it just felt so long. And she was like, I'm headed straight back. I'll be right there. So she comes over and I was like, I'm feeling a little nauseous. I really don't want to throw up at my house. So like if I do throw up in transition, like I'd rather be at the hospital. And so that was when we kind of packed everything up, got in the car, and um, the car ride was not bad. I don't know why everyone said it was weird. The only thing that was weird was that I could legit felt like his head was in my butt, like
Okay.
in the car. Like I could feel like when we bounced in the car, I felt like there was something hard, like a head.
Wow.
And but the heated seats in the car actually felt really good.
Oh,
So
I
I know
bet.
everybody always says the car ride's horrible. That was not bad at all. Like
Maybe they
it
didn't
was
have
fine.
heated seats.
They didn't have heated seats. That's what you need to do.
I just got
Um,
heated seats and I have to say they are so worth
yes. Oh
it.
my gosh. Amazing little birth tool there. But yeah, at this point, as far as birth tools, pain management was literally just the ball, the yoga ball. That was it. Like I wasn't using anything else. So we get to the hospital, and at this point, I'm having to moan through the contractions and I'm having to stop as we're walking in. Like I'm having to stop like every couple
Sure.
feet. So at this point, contractions are probably like a minute apart. So we get up there to labor and delivery, and my pelvic floor therapist had warned me. She said, don't let someone with long nails do your cervical check.
Mm.
And we go in, and the nurse is like, okay, I'm going to check you. And she has these long nails. And I was like, no. So I was just like, hey, still nicer. I was like, hey, please don't take this the wrong way. I'd rather someone else do my check because I don't want like your nails, basically. And so she was like, okay, that's fine. And guess who walks in to do my check? The same nurse we had when I had the UTI, which
Really?
we loved her. We love this nurse. And she walks in and we're just like, you.
And
We
you're
both are
at
like,
the would you're at
at
Northside
the
now,
north. Yeah,
right?
she was
And,
actually a traveling nurse and
oh
she
my
happened to be
goodness.
there that night.
Wow.
And so she's like, oh, yeah, girl, I totally understand about the nails thing. Let me do your check. She checks me. She's like, you're at a 7. And in my
Nice.
head, I was totally prepared to be like a 4. I was
Yeah.
like, man, it is already so painful. I'm having trouble breathing through these, but I'm probably early on. So in my head, I'm discouraged because I'm like, I'm probably just, but knowing that like it'll be okay. And she says I'm at a 7. I'm like, oh my gosh, I made it to a 7. Like, this is amazing. So she's like, how about this? We'll call your doctor in 4 hours. Hmm. Was I going to make
4.
it four
Yeah.
hours at this point? Little did we know. So we get checked into the room. And the worst part is they made me sit up in the bed while they did their putting in the IV.
IV.
So
Yeah.
it was just a saline lock. I didn't need antibiotics, but still they had trouble finding my vein as usual. And I was just like, oh, so that part was terrible. But then they were like, okay, go ahead and get up and go to the bathroom one more time. And then you can get back to your ball. I was like, can y'all just let me get back to my ball? That's all I want. And we had brought like essential oils and like lights and music, all these things. So I was
Nice.
like, go ahead and y'all get that set up. Well, I go to the bathroom and like another change happens at this point. Um, I could feel like change in the intensity. And so I was like, get me back to my ball. So I get back to my ball. And as I like lean over the ball, like total body, like a wave, like through my body, like it flies me back. And there's just this cracking sound as my water just like bursts. And it's just like explodes. And like I'm still wearing like the little postpartum underwear stuff, the disposable underwear. And you just hear this like cracking sound. And I was like, what is happening, y'all? And like the nurses and my husband and the doula are like, oh, we need to get your underwear off. So they like pull it off. I was like, what's happening, guys? Like, what's going on down there? And so I'm leaning over the ball, holding my husband's hand, and each contraction would like rock me back.
Oof.
So I would like rock back and then like kind of hold on for dear life. And then I would come back forward and like rest. And then the next one would come and I would rock back and then I would rest. And at that point, like it was totally fetal ejection reflex. So it's on the floor. They're like, can you move to the bed? And then I hear them going like, Dr. Hill's not gonna make it. We need to find a different doctor. And so I just hear them kind of like running around. I'm like, they're like, oh, get buckets. Which I've always imagined that like from the movies when they're like, get buckets. So here was my moment of getting to hear them say, get buckets. So
Wow.
they they're running around, they're getting the bug, and everyone's calm, but it was still like very fast paced at that point. And right in the middle of all that, my phone rings and it's my doctor on the phone. And my doula kind of holds the phone up to me. And my doula was like, Haley, don't push. There's no one here to catch the baby. And I was like, I'm not pushing, guys. Like, I'm not pushing. This is just happening. I'm not doing anything. I'm just trying to hold on. Like I was trying to make it stop at this point. And so my doctor gets on and he's like, Haley, you need to breathe. And my problem was I couldn't breathe in. And I was
Mm,
trying to do these like pelvic floor breathing where I like breathe in and then relax as I'm breathing out and all that. But I couldn't get a breath in. Like I just couldn't breathe.
hmm.
And so I just like yelled at my doctor. I was like, I can't breathe. And everyone's going, you can, just breathe. So like my doula, my husband, the nurses, everybody's saying, breathe, breathe. And I'm just like, I can't breathe. And then like next thing I know, he just comes like flying out.
Wow. Were you still on
Well,
the
his
floor?
head, yeah, it was on the floor. I
Yes.
was on the floor.
I love it.
The nurses caught him. The doctor, the on-call doctor, she was middle-aged maybe, but she was like, I'm not getting down on my knees, I'm too old for that. And so there's actually a picture of her standing there with her gloves like to catch a baby, but she's just standing there with her hands folded observing
Well, that's kind of
while the
nice.
nurses catch the baby. So yeah, when his head came out they were like, oh, do you want a mirror to see? And I was like, no, because I'm just trying to hold on here. Like I felt like I was on an inner tube being thrown off the inner tube into the water. And
Wow.
so yeah, but yeah, so I was on my hands and knees. His head like crowned really fast and then he just like came out. Like I guess it was another contraction. I did not push though. I did not push. I was trying
Wow.
not to. I was trying to like hold it back. And so and I think all of that after like a lot of the research I did, I think that was because he was in that perfect position.
Yeah.
So every contraction was dilating me because he was so perfectly aligned to where his head was doing the work and my body was doing the work, and that's why I didn't have back labor, and I think that's why it was just so fast. Like from 7 to 10 was about 30 minutes.
Wow.
So
Wow.
and the timing that he was born at 11:30 p.m. on his due date.
Oh,
So guess what? Not only did he make it to 40 weeks, but he did not go over.
yeah, that's amazing.
Yeah. So that was where it
Wow.
was like, sweet little Calvin. I was like, you understood the assignment. The
Yeah, there you
assignment, he
go.
was like, Mom, I did what I was supposed to. I waited to 40 weeks and I did not go over.
Yeah.
So yeah, it was crazy. And my doctor didn't make it, which was exactly like I told you. I was like, I don't need you. And
Yep.
I did not need him.
There you go.
He was not there at all. Like he didn't even show up until like the second day I was in the hospital. I was like, where were you?
Hey,
Like
well, he
you were
called you on the
supposed
phone. A
he
lot
did
of
call, which
people
was really
wouldn't have
cool.
got a phone call. So,
And I do remember that his son, he has several sons, and one of them was like kind of maybe like teenager. And I heard his son on the phone go, Dad, what's that noise?
just somebody having a baby.
I was like, come on, he's an OBGYN. Like, you know what that noise is.
Yeah.
But yeah, so yeah, he was born on the floor and we got to let the cord pulse and everything. The
How did you
stitching me up,
feel afterwards? Like
I
you were like,
felt
I did
just
that.
relief, just
Yeah.
relief. I was like, yes. And just huge relief that I didn't have to just sit in the hospital and wait for it to happen, that it just happened on its own. And just amazing, incredible relief. Like the all the rush, all the hormones. Getting stitched up kind of was a letdown
Mm,
after all that.
yeah.
Because I did have second and third degree tears, which you would think with fetal ejection reflex that I wouldn't have torn so
Mhm.
bad. But his head really wasn't smushed at all. So I think that his head did not accommodate
Well, he
really.
wasn't down in the pelvis very long. So he just
Yes,
came down through. So we
he
didn't
kind of
really
flew
have
out.
time to get molded at all. It just like
Yeah,
boom. Yeah.
yeah, he kind of just flew out. And I also, like I said, I was having trouble like breathing him down. Like I had wanted to really breathe and relax that area, but just hadn't really practiced relaxing through the pain as much as I wish that I had. And so That was another thing that I was like, maybe that was part of it. But that's kind of what I went with as far as like what I would do differently next time.
Yeah.
And I think if it had just been slower, like maybe if I had been on my side or in a water tub or something to kind of get a little bit more relaxed and slowed it down a little bit. I mean, I know most people want to speed up their labor, so it's weird to think like maybe I wish it would have slowed down.
No, I've heard
But
that from several people, especially when you had that quick jump like that to just really, and I've even seen like a client of mine similar to yours, like it jumped really fast and the water broke. And I think the baby just came straight down into the pelvis right when that water broke and even bruised up a shoulder just from
yeah,
coming down on that pubic symphysis or that tailbone so fast.
yeah,
So like, yeah. And then just, okay, hi, baby,
yeah,
Yeah, like absolutely. Like, whoa, hold on, give me just a moment
yeah. Give
to
me a
wrap
second to breathe.
around this. Yeah.
Yeah. And I did all the other things too, the red raspberry tea, the dates, blah, blah, blah. So I definitely did all of the things, but I attribute a lot of it to just that really good positioning that every single day I was doing those squats, I was doing those exercises and really getting my pelvis ready for him. And he was a good size too. He was 7 pounds, 4 ounces. And he did great, like with nursing and everything. He latched
Awesome.
on. I got to take my little V-back picture where I like had my fist up, which that was something that
I
I don't know if a
love
lot of people
it.
do that, but my friend KK had done that, and I was like, I have to do exactly like her.
Well,
So
listeners of the podcast will recognize KK's name, and KK's story has been on here before. And in fact, the thumbnail for her podcast episode is her with her fist in the
yes,
air.
yeah,
So if you want to send us that for this episode, that'd be awesome to
yes,
have your
yes,
same fist in the air.
that was my like dream,
I
and
love
just to see
it.
it like actually happen was just so, so, so amazing. And just to really, I don't think I mentioned this earlier, but one thing that we also did was right around, I think, 27 weeks before I went on the Bahamas trip, we actually had a fasting and prayer day where we really just, I don't think there's anything magical necessarily about fasting, but I do think that there is just like a trust factor where we just decided to give it all to God and just trust that he was going to be in control of this birth. Um, and we had all of our life group, all of our friends fast for
I
24
remember I
hours.
had the
And then,
text.
yes, yeah, we had,
Yeah.
we fasted and then we met and did worship. And it was all praying for Calvin, which I hope someday when he's grown up that I can just tell him, like, God had a destiny for you and the perfect timing for you, and that you were prayed for before you were born. And so, yeah, all of it lines up, and it's just it's interesting too, like wondering if this will be part of his personality because my firstborn was so dramatic, his entry,
Mm,
and his personality is dramatic. Like he always sucked all the attention, like even throughout my whole pregnancy, like his asthma stuff, his personality, like he just was like all the attention's always on my first. And then my second, he just, he does what he needs to do. He kind of
mm,
just slides in right at 40 weeks. He's chill. So far, he's chill. Like his personality is really starting to come out. Like he's going to be a toddler soon. So I feel like he's starting to have a bigger personality than
yeah.
his entrance was not necessarily dramatic. It was like, he did exactly what he was supposed to do.
Mm.
And um, the only other weird things that happened with him like later on was that he did at like I think about 8 weeks old, he did have some signs of a dairy allergy like through my milk. And we went down kind of a rabbit hole of exploring what that was, and it ended up being a parasite. We had a really great pediatrician who went ahead and got his labs done, and he had a parasite.
That's
So
wild.
yeah, so he had to do an antibiotic for that, but other than that, we've really limited that. That was the only antibiotic he's ever gotten. I do feel like his gut is healthier, which is good, which is something I really wanted with the vaginal birth. Was I wanted to have a baby that had just things just set him up for
Sure. Yeah,
success.
yeah.
And with my first, I've kind of come to terms with that. That his gut was not set up for success with being C-section, with being NICU, and trying to navigate that, like with having two
Sure.
sides. And now I have two boys, and that's something I guess you learn as you have more children is just how different each one is. And that's been weird for me being a second time mom because it's like you kind of expect everything to be like the same or start comparing. It's like, oh, one is not really better than the
Mhm.
other, but it is a relief that his gut is way better. So
Yeah.
it's definitely a relief. And it's definitely a goal that I have for my firstborn too. But something that I'm like trying to accept and not always compare. Like they can't control their gut bacteria. Like,
No.
hey, little dude, you need to work on your gut. Like, but yeah, so his gut's been way better. We got over the whole thing. We did have at about 6 months after the whole parasite thing, he had actually lost weight. And
Hmm.
so his pediatrician, she diagnosed him with failure to thrive, which is not something you want to hear as a breastfeeding mom. And we kind of went through a whole journey of that. We never supplemented with formula. So right now we're at 11 months. We've almost made it to 12 months. And we've never supplemented. We've got his weight back up slowly but surely. And it's been an adventure. So, in that
Okay.
sense, that was his only like weird thing where it was like, but also maybe I just make small babies. And I've tried to tell the pediatricians that, like, can we just accept that there are some babies are smaller? Like, they don't all have to be rolly and chunky.
Exactly. Yeah, that's true though. There's such a range from healthy, and even like adults, there's such a huge range and from what what healthy looks like. Yeah. So I think for babies too, we forget that sometimes. Like we
Yeah.
just want to see the chunky rolls and all the
Yeah.
things like that. And we forget that, like a slender baby, as long as they're still, like eating really well and they are growing, that sometimes they can still be just as healthy as that chunky roly baby.
Yeah.
And everybody, like, yes, family genetics have so much to play. Like there's
Yeah.
so many things that come into play for sure. So he's doing well. So what a redeeming birth that was for you. Like,
Yes. It was
yeah,
amazing.
that's
It was
awesome.
amazing.
That's so exciting. So in your free time, so you're working full time
Mhm.
and you're taking care of two little boys and a husband, and you decided why not start a podcast?
I know, like, why not have one more thing? Yeah, I was really inspired by you because I really like the format of your podcast. I like that you're telling these stories because not everybody is an influencer, not everybody like puts out their story, but there's so many good stories out there.
Mm,
And
true.
so what I found with breastfeeding and just being so passionate about it, like I would have people that I was pumping with or people I'd have conversations with that was like, oh, your story's so good. And then I would end up telling other moms. So I would meet with other moms who were struggling through nursing or through pumping. And I would be like, oh, well, I know about one person who went through this and one person who went through this.
Hmm.
And I went through this. And as I would tell my story, these stories, they would be encouraged. And I was like, what if I did the same, something similar to Madon and started my own podcast? So I was praying into that like in January. And right as I hit kind of like 6 months postpartum, I feel like it kind of came to life. I also got off social media for a month. So the combination of like hitting the 6 month mark and then getting off social media, it was like my creative waves in my brain were like,
Oh.
ooh, I can do this and I can do that. So I just got really creative, started working on the brand for the breastfeeding diaries. And then after I did my first two recordings, I got really stalled and like wasn't liking my editing tools and I was really putting it off. And then in April, I went to a women's conference. They were talking about the devil and they were like, the devil is not in every flat tire. He doesn't cause every little issue that you have, but he will use 100% of your flat tires against you. And I realized that I was having all this trouble with technology and stuff. And I was like, maybe there's some good from this podcast.
Mm.
And the devil doesn't necessarily want me to be successful or wants me to make excuses. So I stopped making excuses and I went ahead and got it edited. And I've come out with one episode a week since then. We'll see if we
Wow,
keep
that's a
going with that.
lot. Yeah, one a week is a lot.
Yeah.
Yeah,
So
that's
we'll see.
awesome.
We'll see if I keep going with that speed. It's a little bit fast paced, but it's been really good. Every single story has had a really good testimony,
Yeah.
which I think a lot of your episodes do as well. So very similar for your listeners if they like that kind of thing.
Well, I
So,
love it. I've actually been able to use it as a resource already for some of my
yay.
clients. And so I was really thankful for that. And then I got super excited recently when I saw a little clip and I saw who your guest was because it was Miranda.
Yes.
And I love Miranda. She's amazing. I've talked about her on the podcast before, and she's part of my testimony actually and kind of part of
Oh,
my
wow.
journey. Yeah, so it's really good. She helped me so much after I had my last son. And we got to know each other quite a bit. And yeah, after
Yes.
14 months of PT, seeing her most of the time 3 days a week, then you get to know each other
Wow.
pretty well. Yeah. And so it was so amazing to get to hear her testimony and her story. And so I just have to say, like, that blessed me already getting to listen to that. And
Yeah.
so I love what you're doing. You're doing
Thank
great
you.
work, and I'm so thankful that this podcast was able to influence you in that way a little bit. That's
Yeah.
wonderful. That's
Yeah,
great.
she Miranda helped me a lot too, because like I said, I had the second and third degree tears.
Hmm.
So definitely needed a lot of help with that and the pain. I would say, like, even though I got to have a VBAC and I was so excited about it, the first 2 weeks I was in as much or more pain as my C-section. So that was kind of a
Hmm.
letdown
Yeah,
afterwards of like, well, I wanted to like avoid the intense pain of the C-section, but honestly, I think I was more mobile and like hopping around and getting up out of bed with my C-section than with those second and third degree tears.
mm,
But after about 2 weeks, I made a big leaps in recovery. And so at that point, I was like, oh, this is way better than a C-section.
good.
But the first 2 weeks was pretty much the
Well,
same pain
and
wise.
that was your first vaginal birth, and
Yeah.
so like the good thing is that you can if we're having any more, that you can likely avoid those next
Yeah.
time. Yeah, it's very likely. So
Yeah.
hopefully so. Like what do you guys think now? Like he's coming up on a year old, right?
Yeah.
Yeah.
Yeah, he is. At this point, it's like, it's funny because I didn't really get my menstrual cycle back until 10 months or like 9.5 months. And it was like, as soon as it came back, I was like, ooh, baby fever. Like seeing babies, like, oh, it's like my body just knows.
Hmm.
But I would like to wait a little bit longer this time just because of like daycare costs and all that. But I definitely still want to have more. And I think kind of going into that, just knowing that it is possible that I can have a VBAC. I don't really know if I would go with a doctor, the hospital system. Everything that happened with the UTI kind of makes me want to have that cushion and that fallback of the hospital. But the successes of the birth make me think like home birth all the way. Like I
Sure.
totally would want to do it. So that's one thing that we'll just have to like pray about and see like what we would want to do because I like having the support of the hospital if it's needed. And
Sure.
clearly I've
Well, it's
needed
always
it.
there for an option if
Yeah.
needed. I mean, for my clients as well, if anybody else's, like it's there. But,
Hmm.
there are things about that pregnancy that midwives can deal with too. I mean, not just me, like any midwife that you be around, like the antibiotics and the progesterone and,
Yeah.
and all that testing, like they're able to do all that as well.
Yeah. That's
So
awesome.
that's great for you, for options for you, for whatever
Yeah.
you decide in the
Yeah.
future. That'll be
Hmm.
awesome. I'd
Definitely.
be excited to hear for you. So,
Yeah.
give a little plug about your podcast. I want everybody to know about it.
Yeah, so it's the Breastfeeding Diaries. It's available on anywhere that you can get your podcasts, like Spotify, Apple, YouTube, and then we're on Instagram at the Breastfeeding Diaries podcast. And then I also have an email, breastfeedingdiaries@gmail.com. And Instagram's probably going to be like the best way to get in touch. But I
Awesome.
definitely love to hear other people's stories. I'm starting right now with people who made it to that 12-month mark because
Awesome.
I think that's so important. But
Yeah.
yeah, that's what we got.
Okay, so if anybody's listening and you've got a great breastfeeding story that you'd love to share with Haley, please go check her out on Instagram and send her a message. And I'll make sure to have all the links down below in the show notes, so that you guys can contact her. But yeah, really excited for you, Haley, starting this fun adventure. And you're about to go into the second year having two boys. And so, yeah, that's a blast. Thanks so
Yeah.
much for coming on the podcast
Thank you.
and updating all of us on all the things. And yeah, I'm so thankful to hear that you got to have such a beautiful redeeming birth. And yeah, and just you're doing amazing things, and I love it. It's great.
I love what you're doing too. Thank you so much.
Yeah, you're welcome. Thank you for listening. May you be encouraged and strengthened by what you've heard today. Remember, you are dearly loved by your Creator, so be who He created you to be. May you go in peace, friends. Till next time, Shalom.